Why did you decide to become a caregiver for the elderly?
I have always had a passion for helping others, especially seniors, as I believe they deserve compassionate care in their later years. I find it rewarding to make a difference in their lives by providing companionship and assisting with their daily needs.
What qualities do you think are most important in a caregiver?
Patience, empathy, reliability, and strong communication skills are crucial. A caregiver must also be compassionate, attentive, and able to provide both physical and emotional support.
How do you handle challenging behaviors in elderly clients?
I remain calm and composed, understanding that challenging behavior often stems from discomfort or confusion. I listen to their concerns, reassure them, and try to redirect their focus to something positive. Communication is key.
How do you handle the physical demands of caregiving?
I maintain my physical health by staying active and fit, which helps me manage the physical demands of caregiving, such as lifting, assisting with mobility, and other tasks. I also take breaks when needed to avoid burnout.
What kind of experience do you have with elderly clients who have dementia or Alzheimer's?
I have experience working with individuals with dementia and Alzheimer's, providing structured routines, keeping them engaged in simple activities, and ensuring their safety. I also understand the importance of remaining patient and offering gentle reminders.
How do you build trust with elderly clients?
Building trust starts with being consistent, reliable, and respectful. I make sure to listen to their needs, respect their personal space, and establish a routine that makes them feel comfortable and secure.
How do you handle an emergency situation with an elderly client?
I stay calm and assess the situation quickly. I follow any necessary protocols, such as contacting emergency services, notifying family members, or administering first aid if needed. I also document the incident as required.
What would you do if a client refuses to take their medication?
I would try to understand the reason behind their refusal and gently explain the importance of taking their medication. If necessary, I would contact the family or healthcare provider to find a solution, such as adjusting the medication schedule or finding alternative methods to administer it.
How do you manage your time and prioritize tasks when caring for multiple clients?
I use a daily schedule and prioritize tasks based on urgency and the specific needs of each client. I make sure that all essential tasks are completed, while also allowing time for companionship and activities that benefit their emotional well-being.
Can you describe a time when you successfully managed a difficult caregiving situation?
Once I worked with a client who was very resistant to receiving care. I took the time to listen to their concerns, explained my role, and gradually built rapport. Over time, the client grew more comfortable, and the situation became much smoother.
How do you handle personal care tasks such as bathing and dressing?
I approach personal care tasks with respect and dignity, making sure to communicate clearly with the client about each step. I offer as much independence as possible, but also provide the necessary assistance when needed.
What types of activities do you engage in to keep elderly clients mentally and physically active?
I enjoy engaging clients in light physical exercises, such as stretching or short walks. I also enjoy doing puzzles, reading together, and having conversations to keep their minds active. I tailor activities to each individual's interests and capabilities.
How do you deal with difficult family members or caregivers who may have conflicting ideas about care?
I approach these situations with professionalism and open communication. I listen to their concerns and work together to find common ground, ensuring that the care provided aligns with the client's best interests.
What do you think makes a caregiver stand out from others?
A caregiver stands out by offering not only practical assistance, but also emotional support. Being attentive, compassionate, and truly invested in the client's well-being sets a caregiver apart.
How do you ensure the safety of the elderly client in your care?
I ensure the environment is hazard-free, assist with mobility when necessary, and monitor the client for any changes in their condition. I also follow any safety protocols and use assistive devices when appropriate.
Have you had experience with meal preparation for elderly clients?
Yes, I have experience preparing nutritious meals tailored to the client's dietary needs and preferences. I ensure that the meals are balanced, easy to eat, and safe for clients with specific health concerns like diabetes or heart conditions.
How do you handle your emotional well-being while caring for elderly clients?
I make sure to take time for self-care, and maintain a healthy work-life balance. I engage in activities outside of caregiving that help me relax, and I also seek support when needed from other professionals or colleagues.
How do you deal with elderly clients who are grieving or experiencing depression?
I listen and offer a supportive and non-judgmental presence. I encourage them to express their feelings and gently engage in comforting activities. I also alert family members or healthcare providers if necessary to ensure that they receive the professional support they need.
What is your approach to dealing with elderly clients who are reluctant to accept help?
I try to understand their reasons and gently offer my assistance, highlighting how it will improve their quality of life. I aim to empower them by encouraging independence while offering help when it's needed.
What do you find most rewarding about being an elderly caregiver?
The most rewarding part of caregiving is knowing that I am making a positive impact on someone's life, helping them maintain their dignity and providing them with companionship and comfort in their later years.